day guys, I hope we are doing well and you are welcome to my channel and use the right. Remember to subscribe to my channel and remember to subscribe to my channel. So today I want us to look at AstraZeneca Vaccine, which has been given the go ahead for use in almost about 54 countries across the globe. Let us sit back and enjoy as we go through this vaccine. We'll start from the company and then down to the vaccine, how it was being made. Now, about AstraZeneca. AstraZeneca is a multinational pharmaceutical and biotechnology company with its headquarters in Cambridge, England. AstraZeneca has a portfolio of products for major diseases including oncology, cardiovascular, gastrointestinal infections, neuroscience, respiratory, and inflammation areas. The company was founded in 1999 through a merger of the Swedish Astra AB and the British Zeneca Group. Since the merger, it has been among the world's largest pharmaceutical company and has made numerous corporate acquisitions, including the Cambridge Antibody Technology in 2006, including Spirogen in 2013, and the Definiens in 2014. It has its research and development concentrated in 3 strategic centers, which are the Cambridge, that is in England, Gothenburg in Sweden, and Gothenburg in Maryland in the United States of America. Now, last year was a terrible year, for all of us. People died, people went through hell, people lost their jobs, all because of this virus, that is a SARS-CoV-2 virus. But with the hard work of various scientists across the globe, we have several vaccines which are now being vetted. Some are done vetting, some are done with their clinical trials, others have been approved by the WHO, others are yet to be approved. Now, a wide range of vaccines are being used to reduce people's chances of getting sick and needing treatment or dying from the coronavirus. 2 more of these vaccines has just been shown to work in a large scale clinical trials. The 3 vaccines frontliners are those that are developed by the Pfizer, that is the biotech company, Moderna, and the Oxford AstraZeneca vaccines. Now, Pfizer and Moderna have both developed RNA vaccines, which is a new approach, or which is a new form of developing vaccines in a quick way. They inject a tiny fragment of the virus genetic code into the body, which starts producing a part of the coronavirus and pushes the body to mount a defense. These have been approved for use in several parts of the globe, in Africa, in Europe, and the US. The Oxford vaccine is subtly different as it uses harmless virus to carry the same genetic material into the body. It has been approved in also several parts of to use. It is the easiest of the three to use, as it can be stored in a fridge rather than needing a very cold temperature. All 3 are given as 2 doses, but most countries are prioritizing giving as many people as possible the first dose and delaying the second. Results from a large scale trials on the 2 new vaccines have also presented recently. They are the Jassen and the Novavax. The Jassen and the Novavax vaccines. The work by the Jassen vaccine, which is owned by the Johnson & Johnson, and Novavax will now be reviewed by drug regulators before their jab can be approved. The Jassen virus uses the same technique as Oxford, but crucially given as a single injection rather than 2. This, combined with needing only a fridge to store and 1 billion doses planned this year, means it could make a significant impact around the world. Novavax is using a different old-school approach to vaccines by employing proteins from the virus and a chemical to prime the immune system, which is being injected into the body. How does the Oxford AstraZeneca vaccine works? As I said, it is made from a weakened version of a common cold virus known as adenovirus from chimpanzees. It has been modified to look more like coronavirus, although it can cause illness. Once ejected, it teaches the body's immune system how to fight the real virus, should it need to. Unlike the Pfizer jab, which has to be kept under extremely cold temperatures, that is -70, the Oxford AstraZeneca vaccines can be stored in a normal fridge. This makes it easier to distribute. Okay, I have put together a nice diagram to show you how it works. Okay, that is the AstraZeneca vaccine, how it works. I'll give you some few seconds to look through the pictorial. It is self-explanatory so that you get to understand how these how the AstraZeneca vaccine works. So, as you can see, the scientist takes genes from the spike protein on the surface of the coronavirus and put them in a hamlet virus to make a vaccine. Okay, this is then injected into the patient. Okay, now the second step is that the vaccine enters the cells, which then start to produce spike proteins. Okay, as you can see, the spike protein. The body's immune system then reacts, produces significant amount of antibodies, which then activate the T cells to destroy cells which are of the spike protein. If the patient later catches the same coronavirus, antibodies and T cells are then triggered to fight the virus. So this is how the AstraZeneca vaccine works, has been made to work. Why are some other countries limiting the use of this vaccine? Some European countries initially offered the vaccine only to 18 to 64-year-olds because there was no data on how well it protects the over 65. Both Germany and France have now reversed this stance, and both have now recommended the vaccines for over 65s. The European Medicine Agency approved the vaccine in January for use in all age groups, including older adults. The AstraZeneca says its trial data suggests that it works amongst over 65s. Earlier studies show that older people as well as younger people appear to have equally strong immune response to the vaccine. The Public Health of England submitted a preprint, of a real-world study that showed that both the Pfizer and Oxford AstraZeneca vaccines are highly effective in reducing COVID-19 infections amongst older people aged 70 years and over. Since January, protection against symptomatic COVID patients 4 weeks after the first dose ranged between 57 to 61% for one dose of the Pfizer and between 60 to 73% of the AstraZeneca vaccine. Now, this preprint article which was published, the main aim was to compare the rate of vaccination in symptomatic people aged 70 years of age who test positive for COVID-19 compared to those who test negative. It also compares the rate of hospitalization, in confirmed COVID-19 cases aged over 80 who were vaccinated more than 14 days before testing positive, compared to unvaccinated cases. And it also compared the rate of death in confirmed COVID-19 cases aged over 80 years who were vaccinated with Pfizer vaccine more than 14 days before testing positive compared to unvaccinated cases. Now, in the over 80s, the data suggests that a single dose of either vaccine is more than 80% effective in preventing hospitalization around 3 to 4 weeks after the jab. There is also evidence for the Pfizer vaccine which suggests that it leads to 83% reduction in death from COVID-19 disease. The data also shows symptomatic infections in over 70s, decreasing from around 3 weeks after one dose of both vaccines. The new analysis adds to growing evidence that the vaccines are working and highly effective in protecting people against severe illness, hospitalization, and death. The primary analysis of the phase 3 clinical trials from the UK, Brazil, and South Africa, published as a preprint in the Lancet, confirmed that COVID-19 vaccine AstraZeneca is safe and effective in preventing COVID-19 with no severe cases, and no hospitalization more than 22 days after the first dose has been given. Results demonstrated the efficacy of 76% after the first dose, with the protection maintained to the second dose with an inter-dose interval of 12 weeks or more. Vaccine efficacy increased to 82%. The analysis also showed the potential for the vaccine to reduce asymptomatic transmission of the virus based on weekly swabs obtained from volunteers in the UK trial. The data showed that the PCR positive regions were reduced by 67% after the two-dose regimen, supporting a substantial impact on the transmission of the virus. Now, let's look at the efficacy. Now, first and foremost, the primary analysis for the efficacy of the AstraZeneca was based on a 17,177 participants accruing 332 symptomatic cases from the phase 3 trials in the United Kingdom, in Brazil, and in South Africa. So the efficacy of the AstraZeneca vaccine was done in 3 different countries, that is on 3 different continents. That is in the UK, which represents Europe, in Brazil, that is South America, and in South Africa, which is Africa. Trials which was led by the Oxford University and AstraZeneca, and a further 201 cases than previously reported. Now let's look at the UK trial. Now, the UK trial was a single-blinded, multi-center, randomized, controlled phase 2 and 3 trials assessing the safety and efficacy and the immunogenicity of this AstraZeneca vaccine in 12,390 participants in the United Kingdom. Trial participants to date are aged 18 years or over, who are healthy and have medically stable chronic diseases and are at increased risk of being exposed to the SARS-CoV-2 virus. Participants receive 1 of 2 intramuscular doses of the half dose or full dose of the AstraZeneca vaccine or a comparator meningococcal vaccine. Participants have their blood which was drawn and clinical assessment for safety as well as the immunogenicity at multiple time points up to 1 year post-vaccination was made. Suspected cases presenting with compatible symptoms were tested for virological confirmation by PCR. In addition, weekly swabbing were also done for the detection of infection and assessment of vaccine efficacy against the infection. So this was done in the UK, which was done amongst 12,390 participants. And up to today, from the report or from the research which was done to ascertain its efficacy, shows that those participants are still healthy, and have stable health conditions. Now, let's also look at what happened in Brazil. Just like what they did in the UK, but this time around, the participant that was recruited was 10,300 participants in Brazil. Trial participants to date are also 18 years and over. They are healthy and they are medically stable conditions. Okay, now they were given a half dose or a full dose of the AstraZeneca or the meningococcal vaccine, okay, and a saline as a placebo as a second dose. Participants also have their blood samples drawn and also checked and assessed. Okay, suspected cases presenting with compatible symptoms were tested for virological confirmation by PCR. The same thing also happened in South Africa. Where 2,070 participants were recruited, also aged between 18 and 65. Okay, they were given 2 intramuscular doses of the AstraZeneca vaccines, 2 shots, and their blood samples was drawn and assessed. So as you can see, people. A lot have gone into validating its efficacy. Okay, its efficacy. A lot of have gone into it. Therefore, you are safe, and it has been approved by the World Health Organization by experts, okay, who have gone through this data and then recommended that this vaccine, which is the AstraZeneca vaccine, based on the report, based on the data which has been provided, is okay for use. Okay, and they have been following up to 1 year post vaccination. 1 year post vaccination. So you are safe. Is the Oxford vaccine as good as the Pfizer? Large trials showed that the Pfizer vaccine was 95% effective, whilst the figure for the Oxford one was 62%. But directly comparing results is difficult because there were differences in the way the trials were carried out, and it is important to remember that even the lower 62% figure is better result than the best flu jab, which is about 50% effective. No one who received the Oxford vaccine was hospitalized or became seriously ill due to COVID. A recent study found a single dose of the Oxford vaccine offered 76% protection for 3 months, and this went up by 82% after the second dose. How long do vaccines protect against COVID? It is not known yet. It is still under investigation how long protection lasts with any of these coronavirus vaccines. A study found that unvaccinated persons who have had COVID develop protection for at least 6 months. Vaccines are likely to provide a stronger protection than this. Maybe that people need annual vaccinations as it happens with the flu jab. Does the vaccine protect against new variants? Experts are still studying all the current coronavirus vaccines to check how well they work against new and mutated variants of the virus that are emerging. Government Deputy Chief Officer, that is Jonathan Bentham, says that there is plenty of evidence that the vaccines appear to be effective against the Kent variant that is dominant in some part of the UK. There is less evidence, however, of less protections, for the other ones, such as the Brazilian one and the South African variant. A study based on about 2,000 people with the vaccine suggests that the Oxford AstraZeneca vaccines offered limited protection against mild and moderate diseases caused by the South African variant. South Africa has pulled rollout while it investigates further. Okay, now this is all what I want you to know about the AstraZeneca vaccines, which last week was brought into the country by the COVAX initiative. I want us to go out there. Just know you are safe, okay? Just know you are safe. Just go out there, take the vaccine, protect yourself and protect your family, okay? Thanks for watching. Join me again for the next episode on Sputnik V. Have a blessed week.